Hi, everyone. Welcome to our series on HIV and healthy aging. And I wanted to start off by thanking our supporters and the people that have been so really enthusiastic about what we're about to do throughout this. As you know, we've been trying to create a series on aging in a very healthy way, in an age-friendly way, for people living with HIV in the program. But this is broader than that. This is about aging out in a healthy way for really everyone. So thanks off to the Executive Office of Health and Human Services, where I am. And who am I, by the way? I'm Paul Loberti, and I'm the Director of the HIV Provision of Care and Special Populations Unit at the Executive Office. We've been doing work for people living with HIV, for people with communicable diseases, for people who are LGBT that are extremely vulnerable for a variety of different things, including general things like access and availability for health programs. So we're so happy to be in the front of this and speaking about aging today. We're also going to thank the Rhode Island College for their incredible support of what we've been doing here and for organizing Age Friendly Rhode Island, our staff and students, many of them present here today that have helped us out throughout all of this. Without further ado, our guest speaker today is Dr. Ellie Campbell, and she's originally from Chicago and a graduate of the University of Illinois, Kirksville College of Osteopathic Medicine and the Medical College of Georgia. Board certified in family medicine for almost 30 years, she holds a certification from the American Board of Integrative or Integrative Medicine. She's a solo physician currently with specialty interest in innovative medical practice, design, interdisciplinary collaboration, functional medicine, bioidentical hormone replacement therapy, reversing chronic diseases, cardiovascular disease prevention, and much more. The reality is when I met Dr. Campbell, I was impressed from the very moment that she opened her mouth about thinking how we should all take a little bit of attention to what's going on. In 2021, sometimes we look at the data and see that we're not feeling so good and we're not doing so good. Our data, particularly as it relates to chronic disease, tells us we've got to do better. And I recently read an article that was written really focusing on Dr. Campbell's accomplishments and life story called An Unconventional Approach to Fix What's Broken in Modern Medicine. So, Dr. Campbell, welcome.
Thank you for having me.
Thank
It's
you.
nice to be here. I'm in Georgia, by the way. It's in the middle 50s.
Yeah, look, sunny weather, right? Rub it in. It's so nice to have you. And Dr. Campbell and I are working on a project together regarding hypertension and some digital technology. So we're again so pleased and happy to have you with us today. I want to begin by talking a little bit about your education as an osteopathic physician. This video will go way beyond our live audience today. And we want to really be able to start with basics so people understand the difference between osteopathic medicine and allopathic medicine, which is typically where we see the MD versus the DO. And I don't think it's versus, I just think the compatibility is there, but there's also fundamental differences, aren't there?
Sure, there are. So thank you for allowing me to speak to your audience today. In 11 days, I turned 60 years old. So aging has been on the forefront of my mind as I crossed into this new decade. So, but I don't take any prescription pills for chronic disease. So I have lived a life that we'll talk about and getting down to these fundamentals of trying to stay strong and healthy, because the more resilient we are, the better we can handle the health challenges that come our way. So when I was in school, I wanted to be a doctor since I was like 8 years old. So that was never really a question. And I had a mentor, it was actually a family that I babysat for. They had 4 kids and I took care of them. And he was an MD, specialist in pulmonary medicine and later emergency room. And he was the one that introduced me to osteopathic medicine, because he said, I don't quite understand why, but the grade point average requirements, now we're talking back in the late 70s, early 80s here, right? The requirements to get into DO medical school are a little bit lower than they are to get into MD medical school. And but my best residents that I've ever had in my training have all been DOs. So I would strongly encourage you to go to investigate osteopathic medicine as a career path, especially because you want to do primary care as your career choice. So I did, and as I read about the fundamental differences in the training, it was a match for me. I didn't want to be an MD anymore. I only wanted to be an osteopathic physician. So there's kind of three major things that differ between MD and DO, besides the letters behind our name, right? First of all, we're all of us are fully licensed physicians in all 50 states. We have full prescriptive authority. We can see patients in the hospital. We can deliver babies. We do everything each other does. But there's a philosophical difference, and that's the first thing. DOs are trained from the first day of school in the whole body approach to body, mind, and spirit. And while some MD programs are starting to get on board with this, historically that has not been the case. The MDs are very academic and interested in the science and specifically the drugs and surgery that will solve your problems. And DOs are not that way. We always have spent a lot of time on antecedents of health and social determinants of health and what sort of things got you in this shape. So there's a philosophical difference. Our training is different in that we spend about 200 hours on the neurologic, muscular, and skeletal system so that we learn how to do manual medicine, manipulative training, craniosacral massage, lymphatic massage, or a visceral massage, so that we address some of the disconnection between the brain and the rest of the body by going through the spinal cord and doing adjustments, much like what a chiropractor, sports medicine specialist, athletic trainer might do. So we share a lot of the same techniques. Oh. And the third thing is really the difference in our approach post-graduation. After we finish 4 years of medical school, most physicians go on to do a specialty residency. I did family medicine. That was 3 years of additional training after medical school. A neurosurgeon might have to take 8 years of additional training after medical school. When you're looking at those programs, DOs, by and large, stay in primary care, family medicine, general internal medicine, pediatrics, and then OBGYN is kind of a hybrid but they're both surgeons and primary care specialists. But DOs tend to stay in those primary care, where MDs, only a small percentage stay in primary care, most specialized. They become gastroenterologists, neurologists, immunologists, et cetera, oncologists. All those ologists require lots of additional training.
Thank you so much. And I can tell you from firsthand experience, I've had osteopaths from as long as I can remember and was considering going to osteopathic school as well. The thing that I remember that was really different and impacted my life is the first osteopath I saw said, okay, I want you to walk across the room. And she studied me and said, I just don't like the way you're leaning in to one side. Maybe I'll recommend some cushions for your shoes or orthopedic lifts for your shoe. And she said, that was about when I was about 17 years old. And she said, yeah, that'll balance out eventually, you know. But the reality was that she had an eye towards holistic medicine, as you mentioned. And I was really impressed with that. And also felt that it fit in well with my philosophy as someone who wanted to think a little bit beyond the box of just having a drug prescribed for me. So that was really encouraging. And I love that approach. I think it's great. So then as you were sort of going through this in your own education, I noticed that you said that you started to get your interest piqued in integrative and functional medicine. And could you define what those mean to you and your practice?
Yeah, sure. I mean, and that didn't really happen so much in my training. You know, I thought that being a DO was enough, right? That, I was interested in body, mind, and spirit. And I talked to people about what was happening in their home life and were they able to access the care that they needed? And did they have trouble with, this is all before the internet, right? Did they have trouble getting to their doctor's appointments or their pharmacy or the physical therapy appointments, et cetera? But then for 13 years, I practiced very conventional medicine. I became a lot less osteopathic. I worked in a community health center. We served the rural and underserved in our community here in Cumming, Georgia. I was the first full-time female family physician in the history of the county. So, it was a different place. Now it's suburbia, but back then, 30 years ago, it was quite a rural place. And I got really good at writing prescriptions and making recommendations for all the ologists. And I watched my patients get sicker and more diabetic and more depressed, and knew I really needed to change. So I went to a conference at the recommendation of a pharmacist of mine, and it was on functional medicine. So let me kind of define some of the terms as we think about them, because these may not be familiar. So conventional medicine is what your Dr. Joe does, right? But whether that's in the office, the clinic, the emergency room, the surgery suite, it's a heavy emphasis on medicine and surgery to correct symptoms. And really they're working on symptom correction, not on root cause resolution. They don't care so much why you're coughing, they just want you not to cough. So then complementary is a mainstream medical practice combined together with conventional medicine. So non-mainstream and conventional combined together, that's complementary medicine. Alternative medicine is when we do these non-mainstream practices instead of conventional medicine. And then holistic medicine is a healing practice in which the whole person, the body, mind, spirit, is used to help approach the treatment of the patient. That's very similar to how osteopathic medicine is. It's a very holistic approach. Now, integrative medicine is an interdisciplinary practice. So that's where we work together, conventional and complementary, and we try to coordinate them all together using holistic, patient-centered approaches, including mental, emotional, functional, spiritual, social, and community aspects of health. So isn't that really what most of us want, is an integrative medicine approach? I think most people really do, but that's not to say there's not a role for specialists. We still need them. But in the role of primary care, which is my day-to-day job, I really wanted to have an integrative practice. Now, functional medicine is kind of the newest kid on the block, and functional medicine is really just a thinking paradigm and a framework in which we utilize two things primarily. Number one is a timeline. So when the patient comes to see us, we take a very thorough medical history. My first new patient appointment is usually 90 minutes long. So I take a very thorough history, starting from before they were born. Tell me about what your mother's health was like at the time of her pregnancy. Do you know, were you a wanted or unwanted pregnancy? Did she have an easy pregnancy, labor, delivery? What was going on back then? When you were born, what was it like? Were you in the hospital? Did you go home right away? Were you breastfed? And then all the way through until the patient starts to tell us significant medical happenings throughout their life, whether that's an accident, a surgery, a severe illness. I had mono in college. I was in a bad car accident when I was 27. We put all those things on a timeline. And then very often we can start to see where the dominoes start to tumble, right? Based on their timeline. So timeline is one. And the other thing is called the matrix. So I have a piece of paper and it has antecedents, triggers, and mediators. Then it has all the lifestyle changes at the bottom, and then different nodes that signify the patient's different biochemical system, structural and assimilation and oxidative reduction pathways, and all these little very scientific things that help me to figure out what part of the patient's anatomy or physiology is messed up and where can I have the biggest impact quickly to make them feel better. So functional medicine utilizes many of the strategies of integrative medicine. We just put it in a framework and a thought paradigm of looking through the timeline and looking at the matrix to try to get people better.
So tell us a little bit about, perhaps in a very high-end aggregate way, some of the successes that you've had with your patients.
Probably, I think Steve is a great example. So when Steve came to see me, he was about 40 years old and he was morbidly obese, close to 400 pounds. He was obese, hypertensive, diabetic, asthmatic, had severe irritable bowel syndrome with diarrhea predominant. His diarrhea was so bad that he couldn't even control his bowels and frequently soiled himself. All of that activity in his rectum resulted in an anal fissure. For those of you that don't know, an anal fissure is a very painful condition. Imagine if you have chapped lips and you smile real big and you crack the skin in your lip and it bleeds and hurts. Well, that's similar to what happens at the anus. And then you're having diarrhea multiple times and stretching that tissue and then wiping E. coli into it. It's very difficult to heal. He described it as a 24/7 hot poker up his butt all the time. So he was miserable. He had rheumatoid arthritis and he was unable to work. He was disabled at age 40. Well, his cousin was a patient of mine and she said, I don't know, Steve, maybe, also, besides hypertension, his heart rate was always over 100, usually 110, 120 beats a minute. It should be 70 to 80. So this guy's heart was beating. His old doctor called it, you just have a hummingbird heart, and told him he needed to learn to live with it. That's not normal. And that's a symptom of what we call sympathetic overdrive. His fight or flight system was stuck in fight and flight all the time. He never learned really how to properly relax. So he came to see me hoping that he would get off some of his medicine. And in about 6 months' time, we had him off insulin, off metformin, off his asthma inhalers, off 2 out of 3 of his blood pressure medicines, and his irritable bowel symptom was gone.
Wow.
So what magic did I do to this guy, right? What could this be? Well, first of all, I did a food sensitivity test. I drew blood to check to see if he was having any immune reactions. And lo and behold, gluten lit up like a Christmas tree. This poor guy was having an allergic GI reaction to gluten, the sticky protein that holds wheat together. So he lived off of biscuits and toast because every time he had a tummy ache, his doctor told him to eat toast. He thought it would make him feel better. Pasta, biscuits, gravy, all of these common foods were ripping his intestines apart from the inside, literally. So he stopped gluten, and in a matter of 2 weeks, the diarrhea stopped. I put him on a bunch of supplements, gut recovery supplements that included a probiotic and licorice and aloe and glutamine and vitamins. I measured his vitamin levels. His vitamin D was almost undetectable. His vitamin B12 was almost undetectable. You can't make neurotransmitters in your brain if your B12 is low. And when you don't make the proper neurotransmitters, you suffer anxiety, depression, ADD, insomnia. So you need tryptophan to make serotonin, serotonin to make melatonin, melatonin to get good sleep, and vitamin B12 is involved in all of that. So we fixed that and lots of things got better. He felt well enough to follow my care plan, which was, you need to exercise. He started walking a mile every day, and he took me to my word. He walked a mile every morning and a mile every afternoon, regardless of the weather. If the weather was inclement, he would go to Home Depot, get a shopping cart and walk up and down every single aisle, saying hello to everybody that he met everywhere along the way. Pretty soon, everybody knew Steve, and they knew that the weather was bad outside when Steve was in their store. So over the course of that 6 months, he lost 60 pounds. We reversed the inflammation that was triggered by his gut. That lowering that toxic bucket of inflammation improved his bronchial tubes. His lungs no longer had that inflammation. He didn't need his asthma inhalers anymore. And when the inflammation was settled down in his sinus cavities, he didn't catch every infection that came by. Prior to seeing me, he took antibiotics once a quarter because of sinusitis and bronchitis, antibiotics and steroids. Those both totally mess up your gut flora and destroy the normal bacteria that are supposed to live there. So he had a very hard time recovering from his GI stuff as long as he was fueling the problem with antibiotics and steroids.
Wow.
He had only needed, in the last 8 years, he's only needed antibiotics once. And he confessed to me that he cheaped out and he stopped buying the supplements that I recommended to keep his B12 and vitamin D levels up because he thought maybe he didn't need them anymore. And lo and behold, his immune system tanked, he got sick, he was back on medicine again, and sheepishly called me, suffering for 2 weeks, hoping he could get through it, because he had to admit that he had done a silly thing. And Of course, everybody live and learn, right? You
Right.
learn, you know better, you do better. So now he doesn't run out of his supplements anymore. So he's been
Wow.
one of our favorite patients. He's been with me
Great.
for 8 years. He's now lost a total of 106 pounds.
That's
And
incredible.
and the best part of the story is that he's off disability. He's back
That's
working
wow.
full time. He's had 2 promotions in the last 4 years, and he's a full time provider for his family now. So
Wow. What a great story, and how interesting it is to just think about, the fact that he was wanted to sort of take matters into his own hands. As many of our patients, we see that happening all the time. But the concept here is that it's not an expensive fix, right? It's something that if we agree to and we go into it with our full heart and our full soul and want to change, we can do it without spending incredible amounts of money or time or effort, and really enjoy it in the long run. So that's an incredible story. Thanks for sharing that. So, one of the things is we're focusing on healthy aging, age-friendly concepts in Rhode Island are alive and well. How do you see the concepts of functional medicine and the integrative side of things, particularly holistic medicine, giving us an edge as we age? I think you alluded to that a little bit, but what would you summarize for us?
well, I think that it's all about building resiliency, right? So we need to have the fullest bucket that we can have, so that if something comes in and takes away from us, we're still strong.
Look at it.
So how do you fill your bucket? Well, it comes down to basic fundamentals, right? So we have to be nutritionally sound. For most of us, that means consuming 7 to 9 servings of vegetables every day. That's hard to do, right? That's 1 or 2 at breakfast, 2 or 3 at lunch, 3 or 4 at supper time. That's a lot of vegetables. But if you can do that, the phytonutrients, the minerals, the vitamins that are in those plants, we evolved with those. They give us signals to make our immune system strong. Why is a blueberry blue, right? A blueberry is blue because the sun is beating on the blueberry plant and it needs to make an antioxidant to protect itself against sunburn. So the harsher that climate is for the blueberry, the more rich it is in the antioxidants. We can then eat that blueberry and get all those benefits. So eat clean food. That's our first fundamental strategy. Unfortunately, much of our food is toxic because of the environment that it's grown in. And so we want to do the very best that we can to choose organically grown food, meaning there's not artificial pesticides or herbicides on it. Our bodies are overwhelmed with environmental toxicants, and wherever we can eliminate them, from our cleaning products to our personal care products to our food, we want to get those chemicals out of our system. They gunk up our works and they make it hard for us to stay healthy. So eat organic food, plants mostly, and lots of them. Number 2, drink clean water, especially in our hypertensive patients or your chronic HIV patient population who takes a lot of medicine. There's a lot of stress on your kidneys. And if your water that you drink doesn't come filtered, your kidneys have to filter it. Why give them extra work to do? So drink your water, lots of it. Keep those kidneys flushed. Your urine should be mostly clear, slightly yellow tint. It should never be dark golden. If it's golden colored, you are not getting enough. One exception, if you're taking a lot of B vitamins, it'll be lemon yellow, but not dark golden. Eat clean food, drink clean water, exercise most days of the week. 30 minutes, 5 days a week is our minimum, and you can do more if you like it. I have 200-pound dogs. That's an upper body exercise as well as a lower body exercise when we go for our walks. But
Wow.
just movement, whatever you like to do, dance in your living room, go for a hike. It doesn't have to be in the gym pumping weights. If you like to do high intensity interval training, if you're otherwise strong and fit, this is a little bit harder for those of us on this side of 60 to do those high intensity interval training because we have bad necks and bad knees and whatever. But high intensity interval, you can get by with 12 minutes, 5 days a week.
That's great.
Sleep. I cannot underestimate the importance of sleep. 8 hours every night. We fool ourselves into thinking, I only need 6. I get by on 5. If you actually get yourself in a lab and get tested, you don't do well with less than 8 hours of sleep a night. Also, sleep is that time when your body integrates all of the things that you learned that day. So if you want to have a better memory, sleep 8 hours a night. And as we age, it becomes even more critical that we can retrieve that stuff. Sleep is where our bodies clean out the trash. So we have this system in our brains called the glymphatic system. It's like a lymph system that drains the debris from everyday metabolism out of our brain. That glymphatic system only opens up during deep sleep. So if you're not getting deep sleep, you're collecting trash in your brain, and then that means the signals are slower to go through. When you'd ask my mother-in-law something, she would say, how soon do you need to know? Because the answer would be in there. It would just take a long time to trickle out. And so sleep can make that problem better. Prayer, meditation, quiet time, journaling, gratitude, spending conscious time in these exercises every day are huge. The world is a stressful place. We can't make the world less stressful, but we can make our reaction to it less severe. And we do that by building our resilience, by spending quiet time, by writing a journal and visioning what we want and setting our intentions for the things that we get. You get what you think about most of the time. And if you think about happiness and gratitude, that's where you'll be. If you think about anger and frustration, that's where you'll be. And we know that that drives metabolic processes that more rapidly age us. The happiest people in the world live to be the oldest.
Well, thank you so much. Incredible. And I just want to open it up for the audience if they have any questions, because you answered a lot of the questions that were written in or that our particular consumer group had already asked about, particularly in relationship to supplements or vitamin therapy, food and nutrition. And really the most important part was, can we look at things differently, in medicine? And I think you've taught us and you've shown us that you do. So at this time, I know that some of you had some questions, so I'm going to ask that you lift your mic up and please ask Dr. Campbell some questions while she's with us. Let's start with you.
Thank you, Paul. I just wanted to ask Dr. Campbell about, you mentioned to drink clean water a lot. So my first question is regarding the filter. Is this enough, or do we need like manufactured water sterilized? And my second is, what is the average for an average built person per day?
Okay, so we calculate the ounces based on your weight. So if you're 100 pounds, you should be drinking 50 ounces of water a day. If you're 200 pounds, 100 ounces per day. What is filtered water? What is clean water? Well, there's gradations, right? We have good, better, and best. Probably the best water is what's called reverse osmosis, and that's a pretty expensive filter that you can get put on your house. I have a kitchen reverse osmosis filter. It's got 3 different filters. There's some minor issues with reverse osmosis. It's the cleanest. I have a total dissolved solids meter that I can use. So I stick it in my water to see how many particles there are. Reverse osmosis has 0 to 2. My typical tap water is 60 and dangerous is above 100. So, and those particles, conventional tap water coming from the city has birth control pills, prescription medications, small numbers of bacteria, everything below the FDA limits. But nevertheless, if we're drinking this stuff, it's collecting in our bodies if we don't filter it out. So reverse osmosis takes all those things away, including fluoride and including minerals. So if I'm drinking RO water, I have to supplement with additional minerals because it's not in my water. In a perfect world, we'd all be drinking spring water from a high mountain spring that has no additives in it. The problem with that, though, is that if you're drinking it and you're not living on the high mountain, we have to pay for the trucks to ship it. There's fossil fuel emissions that get it there. And I am really not a fan of plastic bottled water. I think that the plastic, the BPAs that are in the soft water bottles, if it's not bisphenol A, it's other bisphenols. And these are endocrine disrupting chemicals. They mucky up our hormone systems. And the softer the water bottle, the more of this plastic, of this chemical that is in there. So then you deal with the environmental issue of how to get rid of all those used plastic water bottles after they're empty. So I am a fan only of refillable water bottles, and however you filter your water is better than your kidneys doing it. So just having a Brita filter with a charcoal and pouring the water through, that's better, right? Then you go up the stage of good, better, best. And there's not really a right answer. A lot depends on your budget and what's available. The general answer, though, is plain tap water is not the best.
That's great, because
Does that help?
you know, a lot, Dr. Saad, I think that was a great question. Does that answer it?
Absolutely. Thank you so much.
Right. I think too, the fact that if you can't afford more sophisticated filtration systems, you mentioned there are a lot of ways around, particularly with things like a Brita water, you know, sort of container and other things as well. So that's something that we might be able to address.
Hiker and camper, and he has a straw that has a filter built into it. So you don't even have to filter the water in the cup. You just filter the water as it goes down your throat.
Yeah, those are incredible, and they're not that expensive either. So yeah, super. Thank you. Other questions while we have Dr. Campbell with us? I'm just trying to look, and I think the people who wrote in to me with questions, you've answered a lot of them already. One of them was asking a question about how do you talk to your doctor if they're more traditional? And what do? Do you say bye-bye to your doctor, or do you try to work with them? What kind of things would you address for this?
Sometimes you have the choice to just say, see ya, I'm not doing it this way. I have a different philosophy. If we don't match, I'm leaving. But in some communities, there's only one doctor and they don't have a choice, and they have to make do with what they have. So trying to learn some strategies to communicate with that physician may be helpful. And one thing that I have found is if you ask the doctor's help, if you say, I'm having a terrible side effect from this medicine, and I need your help to figure out how to make it go away. Because doctors like to solve problems, right? So give them a puzzle to work on and explain that you have a problem that you need his or her help to figure out. And then you can offer some choices. Is there a drug alternative? Is there something other than the one you're giving me that I might take? Or is there a test I can do to figure out what the side effect might be from? Or is there an antidote for the side effect? So that, give them some choices to kind of encourage the conversation. Dr. Susie Cohen is called the holistic pharmacist, I think is her name. And she wrote a great book called Drug Muggers. Almost every prescription drug, in order to be metabolized, has to use a lot of a certain vitamin or mineral in order to do its thing. What that means is your pool of available vitamins and minerals then becomes lower, and those vitamin and mineral deficiencies can result in symptoms. So the best example of this I can think of is metformin. If you go to the metformin, very common drug, glucophage, used to treat diabetes, if you pull out the package insert and you read about it, it says a small number of patients will experience vitamin B12 deficiency. Well, how does vitamin B12 deficiency manifest? Typically, numbness and tingling in the feet and ankles. So you go to your doctor, you say, I'm having numbness and tingling in my feet and ankles, and the doctor goes, you're a diabetic. You must have diabetic neuropathy. So I'm going to give you a prescription drug to treat diabetic neuropathy. And you're like, wait a minute. Can you check my B12 level? Because I read on my package insert that this drug might affect my B12 level. Sure, we'll do that. Then the vitamin B12 level comes back at 300. The lab's normal is 250 and higher. So the doctor says, oh, you're normal. Don't worry about it. But if you read the fine print on the lab, it says symptoms may develop in patients with B12 levels below 500. So there's a nuance and a subtlety to it. And one of the things that functional medicine does differently is normal is not optimal, right? There's a normal level, but then there's an optimal level. And normal runs around Walmart and optimal climbs mountains at age 75. So if you want to be optimal, you got to know what your optimal levels are and strive for those.
Great. Thanks. I think the message too for all of our patients listening, all of the individuals that are not your patients listening, anybody out there, is really take charge. We're so fortunate today to have the internet. Be careful, but always try to find an expert, a physician, a nurse that's thinking like Dr. Campbell, that can guide you and help you through this. Innovative is one word that comes to mind, but I also think we have the ability to do a little research ourselves. So thank you so much today for the time that you gave us. You're an incredible physician in many different ways, and I'm so fortunate to have the ability to and the opportunity to work with you. So really, from the bottom of our hearts at the Executive Office of Health and Human Services, we thank you for the time that you spent with us. We thank you for your work, and I know your patients are probably just in a place, let's call it heaven. So appreciate you. And the other thing is, you know, I'm a little leery about what you said about moving into 60. I don't believe it for 1 minute, but I think that's because you've been practicing what you preach. So that's incredible. And thank you so much again. Dr. Ellie Campbell, everybody. Thank you.
It was my honor. Thanks for asking me.
Be well all.
Great 2020 and age well.
Age well, that's important. Thank you, everyone. And we do appreciate the opportunity for you to listen for what we've been up to lately. And we do appreciate the opportunity that you've given us to be a part of your lives. Good day.